Welcome to the Your Family Dog podcast, where we celebrate the special bond between families and their canine companions. Our goal is to help families and dogs grow up together, one episode at a time. Welcome back to the Your Family Dog podcast. I'm your host, Tina Spring, and I'm joined today by Nancy Clark, who is a veterinary technician, and she's going to talk to us about laser therapy and our pet dogs and how that can really help our pet dogs have even better relationships and better quality of life with the whole family, because a happy, healthy dog is going to be more tolerant of our children's shenanigans and our shenanigans. So welcome to the show, Nancy.
Thank you. Good to be here.
So what made you decide to become a vet tech?
So that's a crazy 40-year long story. But I've been in veterinary medicine for a very long time. Started at the age of 19 back in California, and it was one of those things where I had dropped out of college without really telling mom and dad that I had dropped out of college, and I was still pretending to go, but I was driving up to see my horse every day, and they found out and they said, get a job or move out. And so the job that I found was at my vet in the kennels. And so I started there and just kind of, you know, it was just a good fit. And so it's been a lot of twists and turns over the years, but um, there was no big career epiphany like, oh, this is what I want to be when I grow up. It was just kind of like, it just
This is
happened.
what I fell into.
Yeah.
So what brought you to Georgia from California? Did you stop somewhere else in between?
No, we've been here for probably about, try to do the math now, 14 years now. My husband's job kind of brought us out here. Um, and so it's been fun. We love it out here. It's been an adjustment, but we love it.
Yeah, the pace is definitely different,
It's
and
just
it's
different.
greener.
It's greener,
It's
yes.
way greener than California.
Yeah, I
California
was
is
gonna
kind
say
of
there's no
brown.
fires out here, but now we have fires
Well,
out here, so that's a
yeah, we've got a
pretty
stinky
terrible.
drought at the moment. I think we're
Yeah.
all praying for rain. So you became an RVT, which is a registered veterinary technician, in 2012. What made
Yes.
you decide to take the leap and get like a regular education and a certificate in vet teching versus just continuing to tech and learn from the vets?
So, I would say it was more, I think kind of the culture in California had changed about that time where, for a very long time, you could work as an unlicensed assistant and have the same kind of level of credibility and job responsibilities and things like that. And I'll just say, I was very blessed to have some wonderful veterinary and veterinary technician mentors for me. They taught me, I mean, everything. I think when people see that you have a work ethic and a brain and a desire, they are really willing to pour into you. And so I was very blessed in that. And I worked at one clinic for 13 years, and he basically said to me, "Don't go to school to be a tech." He said, "I will teach you everything you need to know and more. If you're going to go to college, get a business degree." And so that's what I did when I was working for him. I went to college and I got an associate's degree for business and marketing. And he taught me so much in those 13 years. It was like 13 years of veterinary school almost. He would,
I
answer any questions, teach me anything, show me everything, do everything. And I had probably way more responsibilities than I should have had, that kind of thing if you're looking back on it. But it was fabulous.
Well,
Um,
so it's a practice, right?
yeah.
So, I mean, I know a lot of people, for example, in wildlife rehabilitation, where, you know, springtime is nutty for them, right? They've got
Right,
baby
right.
possums and baby squirrels coming out of their ears, um, and lots of animals getting hit. So they're trying, because
Yep.
the animals are all moving around. So they're trying to doctor everyone at once. And many of them are vet techs, and they've just learned as they've gone because there's there's not a ton of veterinary medicine that's taught to techs for wildlife, but
Yeah.
like tubing a baby possum, like they just figure it out. And it was funny. I was watching one of my favorites the other day, and there was a poor sweet frog who got hit by a weed whacker and lost one leg and broke two others. And he was making splints for his legs. And he's like, you know who taught me that? Me, just now.
Yeah.
Right. Like, he's like,
Yeah.
there's no, you can't go on the internet and be like, hey, how do you splint frog leg. Like,
No.
you just have to figure things out. So I often think that if I had a medical emergency, I'd rather be treated by a vet or a vet tech than a medical professional
No, we always joke around, we're gonna be
because
good
y'all
in
are
the
on
zombie
it.
apocalypse, we're gonna be what you need in the zombie apocalypse, because,
Exactly.
we have rabies training and anyway. So that's basically it. I just, and there wasn't a big delineation between licensed and unlicensed in the practices that I was at and things like that, and then once I left that practice, um, I worked for people that did really want a license, and then which was even a greater blessing, is they utilized people with those licenses to the
Yes,
maximum amount
differently.
of it. So they made it worth it. So, um, in California, they had, you know, 14, 15 years ago, they reinstitute what's called the alternate route, and people think of it like you're being grandfathered in, like you do it for so many years, you're just automatically granted the license. It's not really the way it was. You had to work for so many hours, but then you had to show that you had so much education in certain hours. So, I mean, it was literally compiling, a 4-inch thick binder going back, 10 years to be able to qualify to take the exam, and
Right.
then I took the exam there and passed, and so got licensed in California, and then when I moved out here, I took the national exam and then transferred my license to Georgia.
Nice.
So I'm glad I did it. I didn't feel like I needed to get, licensed for the first whatever 20 years that I was in the profession, but I'm glad I've done it since.
Great. So what are you doing now?
So right now I do some telehealth, but then I have my own laser therapy practice. So it's cold laser therapy. When I started it, I was still in a practice, and so I would see the clients in the practice, and then kind of do my own outside marketing, things like that. I'm no longer affiliated with the practice, so I work with word of mouth from veterinarians who want to refer. I have a lot of repeat clients, and then clients that have told other people and that kind of thing. Um, I had my own back surgery in 2024, so I kind of just had to get out of the field. My body couldn't do the day to day stuff like you need to do.
Right. It's a
So I
very
kind of
physical job.
but I wasn't ready to leave the profession. I love what I do. So I just kind of modified this. And I do like some home health nursing, veterinary nursing and things like that, hospice care. So,
So what led you to laser therapy in particular?
oh, that's an interesting question. So, I had worked in practices before that probably underutilized it. I think some practices really do a great job of utilizing it and some don't. The practice that I was at was not interested in purchasing their own laser, and I could see the benefits of it, and so I tried to get them to buy one, but veterinary funds are thin, and so they wanted to invest in other ways. So I asked her, "Do you mind if I purchase my own?" Um, and practice out of here, and she was very supportive of that and wonderful, and so then it was about finding the right laser, that was veterinary quality but still quite safe, because I knew I was gonna be on my own and not always under the umbrella of a DVM. And I could just see all the benefits, the health benefits for tissue healing, long-term, arthritis care, palliative care for older pets, things like that. Um, so that's why and it was something that I felt like I could invest in and then go out on my own if that came to be, you know? And so it did. It was one of those things. It's becoming a lot more popular. A lot more veterinary technicians are going out kind of in private practice and doing hospice care and home health care and, you know, toenail trims and anal glands and things like that, which I don't care if I ever do another toenail trim in my life. So that wasn't really for me. Um, but it was something that I kind of believed in and felt like I could do so. I could still help people. I could be hands on, but it was something I didn't have to worry about a whole lot of liability. I have liability insurance, but there's not a lot of harm, basically no harm I can do with this laser. So to
Right.
me,
So talk about what laser therapy does for pets and people.
um, so, you can look at the biology and the physics of it for me like 100 times and be like, okay, I have to read that again. I have to read that again. But essentially it is, photobiomodulation. So it uses visible and invisible light to modify, change, react the cellular processes. So, increase cellular metabolism, cellular respiration, essentially out with the bad, in with the good at a rapid pace. So, it promotes healing. The laser that I have actually has a blue light on it also that can affect infection. It so, and I've had a very interesting situation with that early on. Um, but it just essentially promotes healing. So the things in the cell that are good that we want to get back in quickly, it increases that action, and the things in the cell that are bad that we need to get out to reduce inflammation and things like that, it increases that process as well.
So it speeds it along.
Speeds it along.
So does it matter whether it's like a wound from surgery or from an injury that we're trying to heal versus like a dog who maybe has pulled a muscle or pulled a ligament? Does it matter?
No, it can do all those things, and it's based on, um, the most of the lasers today are pretty fabulous. They have their own settings where you're like, "I wanna do wound care," and you put in the setting for wound care, and you hold the laser appropriately and that kinda thing. So, um, there's a lot of, built-in safety features and, presettings that you can do, but there's also room for, um kind of it's almost an art form at the same time. So if I'm treating a dog long term and maybe the first 2 weeks, I get a lot of progress and how well he's moving around and things like that, and then we kinda stall, and then you're kinda like, "Okay, how can I change the settings on my laser to affect the tissue differently?" So I've done, like, post-surgical repair on, like, for example, I had a dog, he was a basset hound, he had a laceration, she lived about an hour and a half away from her regular vet, it came open, um, and she didn't wanna drive that far back and forth. So I came over and we treated him, every other day for tissue repair and healing, and that wound closed very, very rapidly without needing to be resutured. So,
Nice.
yeah. So is that something that would do with a huge wound in an abdomen? No, probably not. But for the wound on the skin, absolutely. Um, I have patients that are, in their teens and they've got, arthritis and just natural aches and pains and things like that. And so the goal with those dogs, um, so I always tell my clients this, the goal of laser therapy is to get your pet off of laser therapy. And that's for like younger dogs, injuries, things like that. I don't want you to need me forever, okay?
Right.
It's a little different with older dogs, dogs that have osteoarthritis. We're doing palliative care at that point. And so then what we're trying to do is extend the quality of life, and try to keep the medications at a minimum to avoid, you know, the adverse effects of long-term, nonsteroidals and things like that. So
Right.
and so some of those dogs, we play with and so we usually do treatments very close together initially, every day or every couple of days for a week, and then we extend it out, and then we try to go see as long as we can go. And sometimes we can get out 2, 3, 4 weeks, and the dog starts to get a little sore or cat starts to get a little sore, and we come back. And so the goal is to see how far out we can go without, so I don't tell people they have to treat every week or things like that because that's not honest. Some dogs might need that, but others maybe we can go out 2 weeks, 3 weeks, things like that to keep them comfortable.
Does it help reduce scar tissue formation too?
It can. Yeah. Yeah. It's
And
more
can it break up existing scar tissue or no?
Um, I've not used it for that. I don't think it really probably could, like proud flesh in horses or things like that. It might be able, and I've never used it on a wound like that in a horse, but it probably could, reduce proud flesh and things like that if you're lasering that wound frequently initially to try to keep those all that under control, the inflammation that causes the proud flesh. But um large wounds that are kind of there's maybe not a skin to close, things like that, where they have to heal by second intention. Laser therapy can promote tissue growth and things like that.
And then is there any contraindications? Is there any time when you don't wanna do it?
Yeah, you don't wanna do it over, like a growth or a tumor, things like that. So if I have a dog that, even if like they have a growth over maybe an area of a knee that's sore, but they've got a growth over that knee, I won't do it until the veterinarian tells me it's okay. The laser itself cannot differentiate between normal healthy cells and like tumor cells. So the same good that it does to proliferate healthy cells, it could do the same thing to cancer. So I won't. So even if they have like a tumor removal, I will not laser that suture site because until
Right,
we
in
know it's like
case
a
we
benign.
missed anything.
Yep, exactly. Just to be safe.
And how does it different from like red light therapy?
It's basically the same thing. There's just different classifications of lasers. Lasers are classified by their ability to cause harm. So, like class 1 lasers and things like that are surgical lasers. They are used for cutting, they create a lot of heat. Um, did I say class 1? Class 4, I apologize. I said the wrong. So, and class 1 lasers are like your grocery store scanners, things like that. It's a laser, but it's not going to do any harm. So, red light therapy, some of them are only work like at the skin level. They're just not strong enough to go below the skin. I know and I honestly don't have a lot of knowledge of how all that's used in like human medicine and things like that, where they're using it for, like facials and things like that. But
Right.
it's all kind of the same theory, and a lot of it is just the depth that the red light will penetrate. And some of that is done through super pulsing the technology, where it will get deep into the tissues for very brief periods of time, versus very short wavelength that stays just on the surface of the skin.
Okay, so for someone who's never had laser therapy on their dog, let's say they have a dachshund, they're getting chiropractic care for that dachshund to try to keep, or corgi to keep that spine, or
Mm.
basset nice and healthy, or for example, me with Silken Windhounds, right? They're athletes. If we go and do fast cat and the dogs are out running and I decide to do chiropractic and then laser, what should I expect from a laser appointment?
The first thing I do, well, I would love if you've already had a vet visit, or a chiropractor, and they say, we know he's kind of sore here, we know he's kind of sore there. This is the diagnosis, right? That's a perfect world. Um, I don't require that for my visits, but it helps versus somebody calling me and say my dog's a little sore, because legally, by law, with my license, I cannot diagnose. So I
Right.
can't come to your house. Even if I come to your house and I'm pretty sure I know what's wrong, it is illegal
You're
for me
not allowed to
to say
say it.
no. So I can say, well, I think his pain is here and I think it's a soft tissue injury. And so we will laser this way. But usually what I do, I come in, I kind of put my hands on the dog a little bit, you feel for an area of pain, feel for areas of heat, feel for areas of swelling, something like that. If you've already seen the vet and or it's already had spinal surgery or something like that, I know where the issue is. Then I will treat based on kind of the animal presents. So sometimes I'm just treating an incision, sometimes I'm treating more for like acute pain or swelling, and sometimes I'm kind of treating for muscle spasms. So it really just kind of depends. And then the next visit, same kind of thing. And if the animal's still in a lot of pain, then we'll treat more for higher pain, things like that. If the animal's a little more comfortable, then we'll back down the laser a little bit to not treat for such an acute pain, but maybe more soothing and try to get the treatment to go out a little longer.
So how long does a session typically last?
Depends on the size of the animal, what we're treating, things like that. For a small skin wound, it might be a minute, 2-minute laser therapy treatment. Very,
Oh,
very
wow.
quick. Um, if we're treating the back or, hips on a German Shepherd, then it might be 10 minutes, 15 minutes, that kind of a thing.
And then how cost effective is laser therapy?
I think that's a personal decision. I think it just depends. I think um, I think for the people that it's very important for your pet to be comfortable and pain-free and restore physical activity, and to know that maybe you're extending the quality of life or the length of time from, 2 months to 10 months or a year. It's hard to quantify that. Um, I don't charge typically a travel fee within, about 30 miles of, Athens area where I am. So it's just the laser treatment fee. And I discount a little bit for packages as well. So if we're doing a a per session, it's based on the size of the animal and the number of areas I'm treating on the animal, um, and, uh, and how many sessions we go out, so
And how many sessions you expect it to take.
yeah, and that can vary, like, for example, the wound on the basset hound, we treated him for about a week. Um, some of my older pets I've been treating for a year or more, I'm treating a whippet that has a history of IBDD, she's had surgery. We treat her every couple of weeks, and we've done so for a couple of years, and she's fully mobile and happy and all those kinda things. Some of my other patients, like you say, do fast cat or they're athletes, and so we have them on kind of a maintenance routine, and so maybe we'll treat them a few days before their event, and then we'll treat them again the week after, and then we may not treat them again for 2 or 3 weeks, kinda depending on how they do.
Right.
If they're a little more sore after the event, we'll treat them, 2 to 3 times over the course of the next week or 2 and then back off.
I
Go
went
ahead.
to observe a fast cat event for the first time ever and left the dogs home. And so I was really impressed that they had a chiropractic vet there. Here in Georgia, it's not true in every state. Those of you who have listened to Dr. Meyer's episode know this. Here in Georgia, chiropractic vets, in order to work on animals, chiropractors must be a veterinarian or get a specific certificate in order to practice. That's not true in every state. So you do want to check your own state to find out what the rules and regulations are. But if they had had laser too, I think that would have like even added a whole nother layer of support for the animals. I've done laser with a number of dogs over the course of my life. I always think they look adorable with their little goggles on. Like they have their little goggles to keep their eyes safe because you can't tell a dog not to look at something. Um, and it's always interesting to me that the dogs do feel some sort of sensation, even though there's not heat. Like you can tell that they're like, what is that? That's weird. And then typically, in my experience, the dogs fall asleep because it
Yeah.
apparently is very soothing. Is that your experience too?
Yeah, I have a lot of them. What's great about, because I can come to the house, that dogs that are more sensitive or fearful of vet, I think, you probably know as well as anyone else, there's a lot of dogs that don't get adequate vet care
Right.
because either mom and dad are afraid of what's gonna happen when they load them in the car and bring them in, it's an embarrassing situation, or the dogs freak
Well, I
out.
mean, just the dog that's extremely car sick, like, it's
Exactly.
very hard to take
Yeah,
those dogs to the vet
exactly.
because it's just awful. Like, it's awful for the dog, it's awful for all the humans. It's even hard on the veterinary staff because dog's stinky and gross,
Right,
and
right.
so it's embarrassing, and so I think there are a lot of people that just over car sickness are like, "Mm-mm, no, we're gonna limit
I
veterinary
agree.
care."
I agree. So I think I love the fact that I can come to the house, and a lot of times the first couple of times I'm there, the pets are like, "Who are you? What is this?" And
"What
then
are we doing?"
usually by the 3rd or 4th visit, they're happy to see me. I had one dog that I treated for the better part of a year till he finally passed, and I just had kind of her code to her house, so I would show up while she was at work, I would go in, I would find him in his bed, we would hang out and laser for 20 minutes, and he'd be out cold, and then I would go and I'd see him again in a couple of weeks, so, um, I think that's like a perfect situation that the owner trusts me enough to do that, and then I have this relationship with this dog where I can keep him comfortable, and then I get a text from her later that night when she gets home and she takes him on a walk, and it's a video of how happy he is and bopping
Right.
around. I mean, that's pretty darn rewarding.
It's pretty amazing how quickly laser can really help.
It
I've
can.
I've definitely seen it with my own dogs where I had a dog who, had spinal stenosis, and
Mhm.
laser helped a lot to mitigate his pain in the early stages.
Yeah,
Eventually, we had to do some other things, but, um, he definitely had more mobility, and it made chiropractic adjustments easier because he wasn't so inflamed and tense when they
yeah.
were trying to do chiropractic to kinda just keep him shored up and moving in the right direction. So
And I'll
do you
say there are excellent physical therapists in our area, and I don't wanna replace those people, that's not where my area expertise is,
Right.
I see things
It's
from a whole
collaborative.
it's collaborative, and so I love to work with pet owners that do have a physical therapist already, a chiropractic, and all that kinda stuff, and I'm just one more, you know, cog in that wheel,
Right.
um, And then there's some pets that don't, mom and dad can't afford a whole lot of stuff, um, but they can afford to have me come out every couple of weeks or once a month, and so there's wide ranges of care, and I'm all for it, so
I think that that's wonderful. And so, you're certified fear-free, yes?
yes, elite, certified fear-free elite.
Thank
It was
you.
kinda one of those things where at the very first practice I worked at back as a teenager, it was one of those things where I had no idea, but it turns out I kinda had an eye for behavior, and so the vet that I worked for at the time sent me, and this was back, I don't wanna date myself, but it was in the '80s, and he would send me to very early behavioral seminars and things like that, and so, just had some very great background in that early on before Fear Free was a thing. And then
Right, before fear-free was a thing. Right.
Before Dr. Sophia Yin was
We all miss her every day.
I actually had lunch with her twice at
Oh,
conferences.
nice.
I don't
Nice.
we
I
weren't
never had
friends,
the
I didn't
pleasure
know
of
her well, but
meeting
she was
her,
amazing.
but yeah, she was really something special, and I think we were all sad when she passed.
Ugh.
So talk about, well, talk about what fear-free is, because I think a lot of people, I talk about it, but I don't know that lots of people know what fear-free certified practitioners, what that really means for their pet.
So, Fear Free is just another way of looking at kind of veterinary care and animal care. I mean, I think it's kind of an acknowledgement that, when people think of veterinary care and healthcare and pets, they think of, you know, physical, only, where behavioral is a huge part and the animal's mental health is a huge part of their overall health and well-being. And animals that are treated in a way that are, um calm and quiet in either in the home or in the vet clinic heal way better than pets that are stressed, things like that. So it's just a way of acknowledging that animals feel fear, they feel stress, and so, in the early days of vet med, we used to call it brutothane. They come in and you hold them down. You do whatever you have to do to get the procedure done, and it's a cold, hard reality, but that's how vet med was, 30, 40 years ago. I think
It was.
there probably are still clinics that way, but it was just a matter of, this animal needs this done. Let's get everybody in the room to get involved, and we're gonna get this done.
Well, and there are times that it's an emergency and we don't have any
Absolutely,
options. The same way
absolutely.
that there are emergencies with people that we don't have time to, like, do it the
Of
warm,
course,
fuzzy way.
of course,
We have
of
to save a
course,
life or
of
try.
course.
Um, but I think, yeah, like, I've I actually, in my 20s, fired a vet in New York State. Um, I took my puppy in for just a well puppy check, and he kept making him scream. And yes, this was kind of a soft temperamented puppy, but I'm like, "Listen, I don't care if I have to pay for 2 appointments.
Right.
Slow down, take your time, and let him be comfortable because he's gonna need veterinary care his whole life, and I don't want his first experiences to be terrible." And the vet just acted like I was a silly goose who didn't know what I was talking about, and I finally just picked my puppy up and said, "Get your hands off of him, I'm going somewhere else."
Yeah,
And and that's when I started going and interviewing vets before I would let them, like, I would have the animal, but no one's touching the animal until we talk about how we're gonna handle them, because there's no reason to terrify a young puppy or a young kitten or an old dog over something relatively simple. Like this,
no,
like, we don't need to do it that way.
yeah,
Um, and really, I'm seeing more and more in younger owners and handlers that they're unwilling to put up with that from, sometimes vets will, or trainers will push it and be more physical with someone's dog than the person's really comfortable with, and they
mhm,
just leave those practices. They're
yeah,
just like, "We're not going back." Like, I actually, um, went and looked at a silken from a breeder, and just how she handled him when she wanted to stack him for photos, I was like, "Uh-uh, we're not doing this," because the dog would be going with her to shows, and I don't want my dog handled that way.
right,
Like,
right,
put the training in so that the animal understands what we're doing, and you can do whatever level of husbandry you need to do. But just being heavy-handed because you're in a hurry and you haven't taken the time and you don't have any patience is not okay with me.
Yeah.
Like, not over simple stuff, right? Again, if it's an emergency,
Right.
all bets are off. I'm not gonna
Sometimes
judge
exactly.
anybody. But, right, if I'm breaking up a dog fight, it's probably not gonna be elegant, right? I'm not gonna be warm and like, "Hey, I know we're
Right.
having big feelings,"
Yeah.
right?
Excuse me, but yeah. Yeah.
But most of the time, we can just slow down, and that's all it takes. Just slow down. Let them get their wiggles out, let them figure out where their feet are and where what planet they're on, and I've long said I actually had Deb Jones on. She has, by the way, I'm gonna talk about again, cooperative care, 7 steps to
Yeah.
stress-free husbandry.
Yep.
Phenomenal, phenomenal program for getting any dog more or cat more comfortable with veterinary care and grooming and handling. And I don't care how great your animal is, there is a sensitivity somewhere. They don't like
Absolutely.
that one pinky toe or don't touch my tail or please don't put your fingers in my mouth, right? They all have a sensitivity about something. I have a lot less tolerance for the manhandling.
Yeah.
And I'm kinda glad that the world's moving more in that direction of like, hey, these are sentient creatures and they have free will and don't push them. Like, you don't
No,
have to. They're really agreeable most of the time. They're just scared.
you're just scared.
And it's
Yeah.
like an alien abduction, right? You're in a weird place with bright lights, people are dressed funny, there's occasionally butt stuff, right?
Well,
Like,
yeah.
it's like it really is an alien abduction, and I I feel for animals. It must be very, very scary much of the time.
Yeah,
I mean, I don't know,
the fact that any of them are ever good is the amazing part. You know, the
right?
fact that you get any that come in and wag their tail and are
And
jumping
they're
off
like,
of
"Hey,
you
what
and
are we doing?"
yeah,
Yeah.
"Give me another
So
vaccine." That's the
so
amazing part.
I've never heard about Stay Together Forever. Are you willing to take a little bit of time to talk about that nonprofit?
Absolutely, absolutely, and I'm not I will, further, upfront, I am their veterinary, they call me the medical director, but I do, like, veterinary care not veterinary care, I give veterinary advice to the fosters and things
Okay.
like that. So I'm not boots on the ground or anything like that. Um, I'm definitely, at a distance, but it's such a fabulous organization.
So what do they do?
So they take in they will provide temporary housing for dogs and cats whose family members are going through a hard time. They've either lost housing or they're going through a medical crisis and they know that they can't provide the care for a short period of time. So we provide foster homes for these pets. If they're not spayed or neutered or up to date when they come into care, we provide that. So when the pet parent is ready to pick up and get back get the pet back in and get back in their lives, they're all up to date on everything and knock on wood, they're healthy when they go back.
That's wonderful.
It's a
So
great organization.
do are they just in Atlanta?
They're mainly based in Atlanta. And so we have one vet that has agreed to kind of see them locally more in Monroe. So if we get fosters out this direction, we do have a vet now in Monroe that will be working with Stay Together Forever as well. But I think one of the main limits is the number of foster homes. Like anything else, if we could get foster people willing to foster in more areas, we could intake more pets and probably more pets in more areas as well. Yeah, so I will
There are some really, really great programs. I I really have a heart for hospice. Unfortunately, I don't have a lifestyle that allows me to do much more than talk about it.
yeah.
Um, I talk to clients a lot about what is your plan, right? I'm here in Athens. We are a college town and a top 10 retirement community.
Mhm.
And sometimes people get animals and like I have a client right now who needs to have back surgery and I'm like, "How can I help? Can your kid come live with me for a couple of weeks? Like what do you need to
Yeah,
just make that a easier thing?" So I love to hear that there's a program that does that. I tend to do it more with my regular clients because I know those dogs and they can come to work with me and I know the
right.
people. Um, but I love that there's a program that does that because I know a lot of times, in particular in like domestic violence or
Exactly.
substance, people won't leave their animals because they don't know where the animals are going to go.
No,
And so you can't get them services because they're concerned about that they'll lose their animals, and their animals are their family.
they're everything. Or people that, have housing difficulties, that are on the streets, those animals are everything to them, and they're not willing to get off the street if it means that they have to go into a place that doesn't accept animals as well. They will prefer to live on the street. And so, I think it's great to be able to provide a situation where someone has the time to find a place to live that will accept their pet, and then they can just get them back on their feet, I think, which is just so amazing. Some of these problems, they seem so daunting and overwhelming when you see them on the news and you see them on this huge scale, but when you just working this with this organization and you see, the success stories and these people that are able to be helped, just 1, 2, 10, 15 people at a time, it feels like you're taking a bite out of some issues. So,
Right. I mean, I have long said that the lens of compassion, if we each individual human kind of works on the thing that wears on our heart and mind and soul, that
yeah,
everything gets taken care of, right? Like
absolutely.
we all have our own gifting for how to help and support. And sometimes that's serving on a board of directors, and sometimes that's, giving $2 a month to
Right.
a cause, or $50 a month to a cause to just help. So, Nancy, if someone wanted to get in touch with you about cold laser, how would they reach you?
I'm on Facebook, All Creatures Laser Therapy. I have a website, allcreatureslasertherapy.com. Um, you can shoot me an email, allcreatureslasertherapy@gmail. I'm actually considering adding, just I don't know if I had time. I've not done it yet, so I may be speaking out of turn, but I'm considering adding, a thermal camera to my practice. Um, it's a big investment, so I'm not sure, I'm not sure if I'm ready to bite that bullet yet, but I think it would just offer a whole 'nother level. These thermal cameras can detect injuries and lameness sometimes 2 to 6 weeks before it actually appears, so a potential issue. So, again, for the sport dogs or the horses or things like that.
Well, and I look at even things like, what are those new pads? I'm trying to think what they're called. I know my chiropractic vet uses an Assisi ring. She loans
Yeah,
one of those out. Um, I have red light therapy for my own animals at home and for my own knee. Thank you very much. Um, I what are the is it
yeah,
PEMR, whatever
yeah,
those. So are
EMF, I
those
believe. Yeah.
another electromagnetic kind
Yeah,
of
that's
thing?
that's what that is. It works a little differently. So it's instead of light therapy, it's like and I don't know a lot about it honestly, but it's like magnetic. If you're on one, you can feel it. It's kinda weird, but,
Ooh,
um, yeah,
really?
yeah. Yeah, I went to when I was before my back surgery, I was having different therapies, and they put me on, like, a magnetic table, and it was like, "Oh, this is weird," you know? "This is kinda, good. Is that good? Is that good? Does that hurt? Does that hurt? Oh, no, I think it is pretty good." So, it's
So it
interesting.
didn't hurt, but you could feel it.
You could feel it. Yeah, it's like almost like vibration kinda thing. Or a
Oh,
pull.
interesting.
Yeah,
I really need to look more into it, just because so much of my practice, I've been in practice long enough that a lot of the client dogs that I've served all these years are getting up there
oh,
and are
yeah,
starting to get a little older. And I
yep,
try to stay on top of all sorts of different things to just learn more. I just like learning. Like
yeah.
I joke all the time. I need another 4 lifetimes to run down
Well,
everything I'm curious about.
there's so many options that people have now for different therapies, and it's not a one size fits all, or, you know, you need to, or an order you need to go in or things like that. I really believe that some medical conditions, and just like all of our bodies are different, same thing with pets, is you might respond to one therapy and not another also. So,
Yeah, but definitely with the hospice care, I think like, ooh, there's all these different things you can try, that it's really interesting.
yep,
Well,
absolutely.
thank you so much, and
You're welcome.
do keep us in touch if you decide to add that other therapy.
Will do.
Like, let us know,
Will do.
um, and we'll talk about, like, how that whole thing works. I would be afraid to have you look at my body with it.
I know, right? Same,
I'm
same.
like, oh, because 'cause I'm at that age where I'm referring to my niece as the good one and the other one.
Oh,
Um,
yeah,
but yeah, our bodies wear out a
they
lot of
do.
times. My brain still thinks I'm 18, but
Not so
Well,
much
yeah,
the rest of me,
that's kind of the cruel joke of it all, isn't it?
right?
Yeah,
The youth is lost on the young. So
exactly.
thank you so much for spending your precious time with us today.
No, thanks for having me. It was an honor. Thank you so much.
And if you want to learn more about laser therapy or Nancy, or even to find a provider in your area, you can reach out to the Your Family Dog podcast at gmail.com or allcreatureslaser@gmail.com. And we'll do our best to get you answers. Thank you for spending your
Mhm.
time with us today. Please like, share, subscribe, let people know that this podcast exists and that we're trying to help dogs and their families be healthier together and live long, happy, healthy lives. Thank you so much. And we'll see you next time on the Your Family Dog podcast. That's it for today's episode. Thank you so much for spending part of your precious day with us. If you enjoyed the show, be sure to follow, rate, subscribe so that you never miss an episode. We'd love to hear from you. Connect with us on social media or email us at yourfamilydogpodcast@gmail.com. We'll see you soon.